I'm Marc Alan here on Cash 22. We'll bring in young, up-and-coming professionals and have them mentored right here on the show in a variety of different fields and professions. You were made to do amazing things with your career. So let's get started. On this episode of Cash 22, I'm with Ryan Olzack. Ryan is a graduating medical or dental student from the University of Michigan. Sorry, Ryan.
That's all right.
He spent 4 tough years in that program, and we're here to learn from him today about what it's like to be a dental student, how he made that decision to go into dentistry, and learn about his dreams, his career ambitions. So Ryan, thanks for being with us.
Thank you for having me.
Yeah, Ryan. So you're about to graduate here this spring from the University of Michigan.
Yep, May 6th. Can't
Great.
wait.
Yeah, that's got to be exciting. How's that feel after 4 years of hard work?
It's very nice to think that I'll soon get paid for what I do instead of having to pay to be able to see my patients and do the work that I do. So it'll be nice to see everything just and get rewarded. You know?
Yeah. I understand dental school is very expensive.
Yes, yeah, it's pretty expensive. Unfortunately, I'm from California, and so being here in Michigan, I pay out-of-state tuition, even though I am currently a Michigan resident. Depending on the school that you go to, but here in Michigan, whatever you apply as is the residency that you stay for the remainder of your tuition. So I have a little bit extra debt compared to some of my Michigan classmates.
Oh, right. If you were to move to Michigan for a couple years beforehand, could you have become a resident? Do people ever do that?
Yeah. Actually, I have a friend who, his wife was from Georgia, and they moved to Georgia, and he was a resident there and was trying to get into the dental. There's only one dental school in Georgia, and he was trying to get in there. And while he was applying, they only accepted Georgia residents. So that was kind of why they moved there, and yeah.
Yeah, that's interesting. So let's go back to before you started dental school. When was the time when you first decided to become a dentist? Were you in high school? Was it before that?
No, it was definitely in college. I was pretty fortunate in the sense that if you take care of your mouth and you don't really have a whole lot of cavities, most of the time when you go to the dentist, you don't actually interact with the dentist. You mostly interact with the hygienist. So I didn't really have a whole lot of personal experiences with the dentist. I only had a few cavities growing up and didn't have any negative experiences, so that helped. But it was definitely in college when I decided that dentistry was the route that I wanted to pursue. When I started college, my dad actually told me, he said, if I could do it all over again, I would be a dentist, because my dentist gets to go and play golf every Friday instead of working. And you should do that because you'd love to play golf every Friday. And I was like, oh yeah, of course. Who wouldn't want to, only have a 4-day work week and be able to go and do whatever you want? And little did I know, things have changed, and I'll probably be my dad's age before I'll be able to afford to go and play golf every week. But it was definitely in college when I decided, and it was after I actually went and shadowed a dental office with the school's pre-dental association. And one of the things that I really liked about dentistry, I went into college knowing that I wanted to do something in the medical profession, whether it be a physician, physical therapy was appealing to me, and dentistry because my dad said, hey, look into that.
What was his profession, by the way?
Oh, my dad was a commercial real estate agent.
Okay.
So nothing medical,
yeah.
no.
Right.
But my mother was a registered nurse,
Okay.
and she did hospice care most of my childhood. So I've been around the medical community, and when I was a kid, she would take us to her patients, and with her at least. And so I got to see firsthand what practicing medicine's like.
Right. Okay. So you shadowed a dentist. You thought, this is interesting. I could do this as a profession.
Yeah. One of the things that I liked, especially with this dentist, was that he had a relatively newer, within the last 10 years to 15 years. I mean, they've been around longer, but they're becoming more popular, is the CERAC system, which is the same-day crown, which is where we use an intraoral camera to take a digital impression of the tooth after we've prepped it for a crown. That downloads it to a computer station where the dentist then designs the crown exactly how he wants it made. So he gets full artistry over how it looks, which is a big plus because traditional crowns, you take the impression and you send it to a lab, and a dental technician makes all of the judgment calls on what it looks like and everything like that. And then you send it to a milling machine, which you have in your office, and anywhere from 6 minutes to 20 minutes later, depending on how accurate you want it to be in the dimensions, you have a full crown ready to be cemented in the mouth, and the patient can have a 2-hour appointment where they come in needing a crown and walk out with a permanent crown cemented in place, whereas the normal process of making a crown is that you go in, dentist prepares the tooth, takes an impression, he puts a temporary on, and I don't know if you've had a crown, most people, the temporaries
I have one,
fall off.
actually, yeah.
Most people, their biggest complaint about having a crown is the temporaries keep falling off. And
okay.
we have to have a temporary put on there because we have to send it to a laboratory technician who then fabricates it. Usually it takes a week to 2 weeks, and then they send it back. We make sure everything fits, and then we cement it in place.
Oh, okay. So this is a new procedure? You just...
Relatively new. It's becoming more popular. It's a very expensive system, so not every dental office has it, but it was nice to see that because I got to see some new technology, especially things that I wasn't accustomed to because I've only had a couple cavities up to that point.
Right. Yeah, when I was a kid, I went to the same dentist, like from a baby through college, and it didn't seem like they updated anything in the office. Has it evolved a lot, the profession, over the past 30 or so years? Over
the past 30 years, absolutely. And the big difference is the technology as well as the materials. Computerized dentistry is becoming very, very popular in the sense that we're able to use intraoral cameras to take digital impressions, which is much easier than a traditional impression. If you've ever had one of those done, they can...
with the silly putty you bite into?
Yeah, the silly putty that you bite into that makes you gag, that nobody enjoys.
Yeah, that's not very
So it's
fun.
much easier if we just put a little camera in there and essentially take a number of pictures, and we're able to get all the information we need from that. But the dental materials themselves have come a long way in the last 30 years.
Yeah, okay. Let's go back to when you decided to become a dentist in college. Were there other professions outside of medical that you considered, or did you say, I need to be in this area?
I kind of knew that I wanted to do something in medicine. I like the aspect of being more hands-on with what I did as a profession. I didn't really see myself sitting behind a desk or talking to people over the phones and being like a salesman or anything like that. I really saw myself interacting with people face to face, and I've always liked doing things with my hands, so I wanted something that was a little bit more skilled as opposed to a position where you're communicating, and that's, your ability to communicate and ability to sell yourself and sell your products is what you do for a living.
Right. Yeah, that's interesting. So you said you like to work with your hands, have these interactions. What would be a few things somebody should ask themselves if they're considering becoming a dentist? How would they qualify their interest to say, this is the right fit for me?
That's kind of a hard question in the sense that there's no real one way or correct way to know that this is something that you like. The best way to do it is to go and actually shadow a dentist and see what they do day in and day out, apart from going in and doing a normal exam on a patient who takes care of their mouth and doesn't really have a whole lot going on. Get to see some of the more artistic sides where, for instance, especially in this area, hockey season, somebody gets hit in the face with either a puck or a stick and they break some of their teeth off, and we get to build those teeth back up and hopefully make them look like nothing ever happened.
That probably happens more in Michigan than California.
More in Michigan than California, yep.
Yeah, wow. Okay, so now that someone or you have decided to become a dentist, what do you do next? Where do you go from there? There's tests, entrance, applications. What do you do?
First thing to do is to look at the prerequisites so that you can take the dental admissions test, which usually are number of biology classes, number of chemistry classes, physics. For Michigan, they also require psychology and sociology, and quite a few schools are leaning more towards those classes as being prerequisites, simply because as a dentist, you interact more with patients, a little bit more than a physician who is, say, a surgeon, to where your patient comes to you for a specific reason and you just need to communicate what you're going to do. With a dentist, we do every aspect of dentistry a general dentist does, whether it's surgery, whether it's a simple filling, whether it's just keeping the patient caries-free or disease-free.
Oh, okay. Yeah, psychology, sociology. I never knew those were prerequisites.
Yeah.
Oh, that's really interesting. Okay, so you take the dental admissions test. How much studying is involved there?
Quite a bit. There's different methods to study. I use the Kaplan course to help me study. And what the dental admissions test is, it has a number of parts, has a biology part, has a chemistry part. And the main difference between the dental admissions test and the MCAT for medical school is that the MCAT has physics, which the dental test does not. But the dental test has something called the perceptual ability test, and that's testing your ability to kind of envision things in your mind in a three-dimensional space. Because unfortunately in dentistry, a lot of things happen in 3 dimensions where we only have 2 dimensions as far as our resources. For instance, radiographs or x-rays. X-rays of your teeth are only 2 dimensions, but it's of a 3-dimensional structure of a tooth. So you need to be able to look at something that's 2-dimensional and be able to see in your mind exactly where that is. And there's certain things that you can't really learn unless you at least look at some of the books for preparing for the dental admission test that you really wouldn't be able to get any other way. For instance, one of the things, which is fairly self-explanatory, didn't really take a whole lot of studying, but did take some practice, was angle ranking, where it's simply they have a V that is in a certain angle, and they have 4 of them. One side can be short, one side can be long, they could both be even, but you have to rank them from either the greatest angle to the least angle, and sometimes from greatest to smallest, there's only 6 degrees of difference between those. To where, you know, it just takes practice.
Okay, so some math and geometry is involved there.
And being able to look at something and be able to spot the difference, it's kind of like an IQ test, and there's not really a way to study for it, but the more you practice, the better you become, and the more it becomes second nature to you.
Okay, so somebody that's enrolled in these prerequisite classes, considering taking the test, how much time should they plan to prep for that and study?
I would say at least 6 weeks to 2 months, so 6 to 8 weeks would be sufficient time to review all the material, because it's going to be multiple semesters of coursework that you might have taken a year and a half ago that you need to refresh on. But it takes a while to get through everything, because you want to have a good score your first time. Because if you don't get a good score, which happens, you know, you better get a good score the second time, or at least show a decent difference between the two. Otherwise, dental schools are going to see the first score and see the second score and say, you know, this person obviously didn't study, or they don't know the material, or simply it's just somebody that we don't want to have in our school.
Okay.
So you always want to put your best foot forward and put the time in so that you can, you know, put that best foot forward.
And how was that test when you were actually in there taking it? Were you pretty nervous?
Very, very nervous, very stressful. It's a very stressful test. The last portion of the test was a math section, and you had 30 minutes to answer 45 questions. So you had less than a minute per question. And some of the questions were multi-step, to where you needed to be quick about it. And I'm okay at math, but I am not fast at math. To where I ran out of time on that portion, and I was guessing at the end, and I answered my last question, which was a complete guess, with about 2 seconds left on the clock. And I remember once the time got to 0, I went, well, I failed that. I mean, I felt okay about other parts, but just that last section just really made me feel like, oh, I did horrible. I guess I better go back and study, and I
well, you
spend
must
another
have
couple
passed,
$100.
right? Did you do it again? Or
No, so thankfully I I didn't have to do it again, but I did get a bare minimum score on that math section. So you get various scores. So the score itself gets broken up into each individual section, as well as what's known as the academic average. And so my scores, I had a 19 academic average, which is okay, not great, not bad. Average, I believe, is 17, but the average of getting into dental school is 18. So I was slightly above average.
Okay.
Some of my classmates came back, like, yeah, I got a 22, and I'm like, oh, great, maybe I should.
Well, you're here at Michigan, right? That's a great dental school.
So yeah, so that's one thing that.
Are there other things they look at? I mean, your college grades, the test. Is it anything else? Are there essays or any?
Yeah, so you do have a personal statement as well. But the application process it's really unique in that there's no right way to really approach it. So that last math score, everything's out of 30. So I got a 19 academic average. Everything else I got a 20 on. The biology, the chemistry, everything I got a 20. The perceptual ability I got a 21. But what brought my score down to a 19 was that math section. I got a 14.
Oh, right at the end? Was that?
Yeah, that was that last one, a 14, which is not good. And 14 is the bare minimum that pretty much every school will allow without you requiring you to retake the entire test.
Okay.
So you don't just retake one section, you have to retake everything. And I was sitting there thinking, well, maybe half of my 20s were probably lucky guesses to where I don't have to retake this. So I applied to 25 schools because I was worried that that 14 would really
That must have taken a lot of time in itself, applying to 25
Yeah,
schools.
and expensive.
Each application costs a couple hundred dollars?
Yeah,
wow,
essentially.
Yeah, it's expensive.
Yeah, so it was expensive, and I think I definitely overdid it. I would say don't apply to over 12 schools. I think 12 is a better number than 25. But I kind of used a shotgun approach because I was really nervous about that low score. My grade point average was good. And your grade point average gets broken down as well into your BCP GPA, which is your biology, chemistry, and physics. So only classes that pertain to those subjects are included into that, that GPA. So where I had classmates that were of a different major. I was a biology major. They did like exercise science, so most of their core classes for their major weren't included in that BCP GPA. So if their prerequisites, which were the only biology, chemistry, and physics classes they had, if they weren't A's, then their GPA was lower than what mine was because I had a lot more classes to help buffer that part of my GPA. So I had a decent GPA. I had an okay DAT score. I had a decent number of shadowing hours. You need at least 100 hours, I believe it is, of shadowing dentists in the area.
Okay, that's great.
So I felt like I was competitive but not really stand out, hence why I applied to 25 schools. But oddly enough, out of all of my friends that were applying at the same time as me, I had the most number of interviews and I got the most number of acceptances.
That's great.
What I really think it's just plain luck. Whether it was my personal statement that made me stand out or simply that my application wasn't identical to 5 other applications that that particular admissions officer had looked at, to where if mine looks like 5 other guys, I'll probably get put in a different pile, whereas if I was the first of those 5, then I might get put in a separate pile. So I applied really early, which is, in my opinion, very, very key to getting into dental school. Apply early. Get the best grades that you can, get the best DAT score that you can, and to apply to schools that you know that you want to go to.
Great. So now you're here at Michigan, about to graduate. What was dental school like? It's a 4-year program. How do they break that up in terms of first year versus 3rd or 4th year?
Yeah, so I'm in my 4th year now. First year, you're pretty much 100% in classwork as well as preclinical. So one of the big differences between dental school and medical school is that medical school, you're in classes almost the entire time for all 4 years, with the exception of going on rotations, and kind of shadowing or observing all the different specialties that there are in medicine, since there are literally hundreds of specialties within medicine, whereas dentistry has a handful. So with dentistry, during the 4 years, you're not only learning everything, but you're also learning how to apply it and practicing. So your first year, you're learning all the sciences behind dentistry and all the sciences behind all of our materials, all the bookwork, as well as learning the basics of dentistry, which is restorative dentistry, doing fillings, doing crowns, things like that. And then your second year, you actually start seeing your patient for the first time, at least here in Michigan. We see patients earlier than most schools.
Okay, that's great in the second year.
Yeah, absolutely. So I did my first filling June of my second year, so less than...
Did the patient know it was your first filling?
I told them afterwards, and
Okay.
I'm not sure if they were comforted or not.
Right.
But
you did it okay?
Yeah, everything turned out fine.
All right. Did you feel shaky at all?
Oh yes, I was very shaky. But I mean, I knew what I was doing. I'd done it hundreds of times on a mannequin. I just hadn't done it on a real person.
Right. Okay.
But you know, you're supervised. They don't let you do anything that's going to damage or hurt the patient to where, you know.
It's pretty safe. So.
It's safe. It's just, you know, it's always, whenever you do anything for the first time, it's nerve-wracking. But yeah, I did my first filling, gave my first shot and filling, did everything all by myself within a year of starting dental school, which is...
That's exciting.
If you told me that when I got into dental school, I'd probably have a heart attack thinking that I would be actually working on a patient that soon.
Right.
And then, so your second year, you start seeing patients more, and you start learning the more specialty aspects of dentistry. You start learning about orthodontics. You start learning about periodontics, which is the gum health and periodontal surgeries. And then your third and fourth year are your more clinical years, where you put into practice those things, as well as learn some of the more surgical procedures, such as extracting teeth, as well as performing some of the minor periodontal surgeries.
Wow. That's amazing. So you've actually pulled teeth
Yep.
already? Okay.
Yeah, I've probably pulled over 100 teeth, but I don't keep track, but I've pulled quite a few.
You don't have a little box at home with all the teeth?
Nope, I don't. But I did take a picture of the first tooth that I pulled, so
yeah, that's exciting.
I could have...
yeah, great.
Yeah.
So we have a few minutes left. I want to hear about what you're doing next. I hear you're going to Hawaii. Is that correct?
Yeah, so I'm very fortunate. My wife's family lives in Hawaii right now. They're from California originally, as am I. But they moved out to Hawaii about 8 years ago, and we wanted to go spend a year or so out there. And why not?
That's a nice
go
thing about being a
bit of
dentist. There's a need everywhere, right?
That there is. And Hawaii has a very unique need in the sense that there are islands where people live on, and there's very little medical facilities or medical personnel in those areas. So I will be working on Oahu 3 days a week, and I will be actually commuting to a small island called Lanai, which is off of Maui, where there's about 3,500 people that live on that island. And while
I've actually been to Lanai before.
Have you?
So, yeah.
It's a nice little island.
It's small.
Yes, it is small. There's one city, Lanai City, and that's about it. But yeah, 3,500 people, and while I will be working there, with the exception of the dentist who manages that practice, because I will be an associate under him, I will be the only dentist on the island.
Wow.
During the days that I'm there.
Anyone has a toothache, you're the guy.
Yep, I'm the guy. Yeah, so kind of nerve-wracking, but I will learn a lot.
And you'll be wearing an Aloha shirt to work?
Yep, so I'll change out the scrubs for slacks and a flowered shirt.
Yeah, that sounds pretty nice. Was it hard to get the job? Were the interviews tough?
Yes and no. I lucked out in finding the job that I did, but Hawaii is a tough market to crack into unless you're not very picky on where you go. For instance, if you don't mind going to a small island for a couple days a week, you know, if you just want to stay in Honolulu, say, which is the most populated city on Hawaii, which is on Oahu, if you just want to work there, there are hundreds of dentists in, you know, just the Honolulu area, and good luck. You know, it's hard to break into markets like that. But I really lucked out. The company that thankfully hired me is expanding, and they are looking for new dentists to, to work in some of their new offices, as well as work in the more limited locations such as Lanai.
So I imagine your classmates are going all over the place. Are many of them trying to stay here in Michigan, or just scattering?
So for the most part, dental students tend to stay around the area where they went to school, oddly enough. That's where most people try and stay. But I do have quite a few classmates that are from California that are planning on going back to California. I have quite a few classmates that are from, say, Florida, going down there. But a majority of my classmates are either staying in the area or going on to specialize.
Okay, great. And did you decide to specialize?
No, so I'm just going to be a general dentist, but specializing, you could go straight out of school, or you could go work as an associate for a year or so, and then go back and apply to a specialty program and possibly get in.
Great. Well, Ryan, we've enjoyed getting to know you and learning about dental school, and it's exciting that you're going to Hawaii. I'm a little jealous about that, especially during the winter. But what we're going to do is we're going to try to line you up with a dentist that's been practicing for 10 plus years and have you back on the show so you can ask advice about where to take your career, whether you should own your own practice or where you should live, things like that.
Yeah.
So we look forward to talking to you again soon. And I'm Marc Alan. Thanks for joining us on this episode of Cash 22.